Constipation is twice as common in women compared to men.
Can constipation be a sign of more underlying condition, very serious condition?
Most common factors that cause constipation are lack of fiber in the diet.
So what are the side effects of constipation?
The patient is straining to pass stools or there's a sensation of incomplete evacuation, then it is called as constipation.
Hi, hello, namaste viewers. Welcome back to our YouTube channel. I am Shweta from Bangalore Gastro Center. In today's session, we'll learn about one of the most uncomfortable condition that is known as constipation. To get rid of constipation, what are the precautionary measures we have to take? To discuss more about this topic, we have Dr. Tejaswini Dande, gastroenterologist with us today. So let us welcome ma'am. Namaste ma'am.
Hello.
Ma'am, nowadays, if we see, most of our youths are facing this kind of constipation problem. So first of all, what do you mean by constipation, ma'am?
So basically having a bowel frequency of 3 per day to 3 per week may be normal. It depends on the individual. Whenever the bowel movements are less than 3 per week or there is hard, lumpy stools, difficult to pass stools, the patient is straining to pass stools or there's a sensation of incomplete evacuation, then it is called as constipation. Now, constipation can be caused by various factors. The most common factors that cause constipation are lack of fiber in the diet, lack of adequate water intake. There can be lack of physical activity as well. All these things are the most common causes of constipation. Apart from this, certain medications like antacids, even certain iron medications can cause constipation. Certain medical conditions like thyroid diseases or diabetes can also cause constipation.
Ma'am, as you said, if we do not drink adequate water, constipation may occur. So what about women, ma'am? In women, the most common problem is constipation. So what about that?
Constipation is twice as common in women compared to men, mainly because of the influence of estrogen and progesterone hormones on the gut. These hormones tend to slow down the muscle contraction and slow the emptying process in the gut. There's an entity called as slow transit constipation, which generally occurs in women in their 20s, wherein they may not pass stools even for up to a week. IBS is another thing which is more common in women, again, twice as likely to happen in women than in men. There's a miscommunication between the gut nerves and the brain in irritable bowel syndrome, and patients tend to have pain, abdomen, bloating, and constipation.
So what are the side effects of constipation, ma'am? Can you brief it?
Yeah. So what happens in constipation is whenever there is chronic constipation, there can be increase in the intestinal pressure. That can cause rectal prolapse, hemorrhoids, fissures, ulcers, and sometimes certain shallow outpouches in the mucosa called as diverticulae.
Can constipation be a sign of more underlying condition, very serious condition?
So constipation can sometimes be a symptom in patients with some serious underlying conditions like colonic narrowing or colorectal cancers. Especially if you have blood in stools along with constipation or unintended weight loss, loss of appetite, fever, or someone above the age of 50, then please meet with your medical gastroenterologist as soon as possible and seek consultation. Colonoscopy may be advised in certain situations like this when there are alarm symptoms, wherein a flexible fiber optic scope is passed through the motion area and the entire large intestine and a small part of small intestine is checked. If anything significant like ulcers or swellings are present, they can be biopsied.
So what is dyssynergic defecation?
A person with dyssynergic defecation experiences a sensation of incomplete passage of stools, or there is a sensation of obstruction to passage of stools. Sometimes some people can also use fingers to manually evacuate the stools. This is again more common in women compared to men, especially because of injury to the pelvic floor during childbirth. It can also be a faulty learned behavior. There is a treatment called as biofeedback therapy that can be done in this condition.
Ma'am, can you give some tips for our viewers to manage the constipation? And one more thing is, can you give some of the tips for food intake also?
Constipation whenever people have constipation, it is recommended that, they take higher fiber in their diet. Up to 25 to 30 grams of fiber per day is recommended. This is present in vegetables, fruits, seeds, nuts, lentils, legumes. So you can take things like beans, broccoli, apples, bananas, whole wheat, bran, lentils, chia seeds, almonds. So all these things are rich in fiber. Fiber tends to bulk the weight of the stool and also makes the stool softer. So this helps in smoother passage of stools. Along with this, avoiding processed food and meat would be recommended because they typically lack fiber. Drinking at least 2 to 3 liters of water every day is extremely important to prevent constipation. 45 minutes of physical activity every day. It has to be moderately intense physical activity. So be it fast walking, running, jogging, or any other sports, if you like, which requires you moving around quite a bit, is recommended. And also one can utilize a 5 to 6 inch footrest to increase the intra-abdominal pressure and help in smoother passage of stools.
And thank you so much for giving a lot information about this constipation, ma'am. Thank you so much.
Thank you. Thank you so much.
So viewers, in today's session, we came to know about constipation. To get more informative videos like this, please subscribe our channel and share to your friends as soon as possible. Thank you so much.